Perfect. Well, hello everyone, and welcome to the 22nd webinar in the Joint Tran-SET webinar series, which will cover different projects related to impact of COVID-19 on travel behavior from two quite different perspectives. Okay, second. Just put this down here. Today, we're privileged to have three transportation experts presenting in this webinar. We will have two 15 to 20-minute presentations. First, Dr. Hany Hassan and Bernard Boakye will discuss senior mobility preferences and challenges before and during the COVID-19. After that, Dr. Irfan Batur will present on the evolution of mode use due to COVID-19 pandemic in the United States, implications for the future of transit. We will save questions until the end of the two presentations for a 15-minute group Q&A, and you can always type your questions anytime throughout the session. Without further ado, I will introduce our first speakers, Dr. Hany Hassan and Bernard Boakye. Okay, Dr. Hany Hassan is an assistant professor of transportation engineering at Louisiana State University. He's a professional engineer in the state of Louisiana and has over 20 years of experience in both industry and academia. Dr. Hassan is currently serving as a member and paper review coordinator with two TRB committees, Intelligent Transportation Systems and Human Factors of Infrastructure Design and Operation. Dr. Hassan's areas of research include intelligent transportation system, traffic safety, and road users' behaviors. Bernard Boakye is a master's student at the Department of Civil and Environmental Engineering at LSU. He has special interest in ITS, traffic safety, and travel demand modeling. His passion is to find ways to improve transportation systems using statistical and machine learning models. Dr. Hassan and Bernard, I will turn it over to you now.
Thank you very much.
So Bernard, can you please share the presentation?
Okay.
Perfect.
Yes, thank you so much, Daniel, for the great introduction, and thank you everyone for attending our presentation. It's my pleasure to give this presentation about the transit project. So we appreciate the support that we have received from transit to talk about our research. So my name is Hany Hassan, assistant professor at Louisiana State University, and I will give this presentation with my master students, Bernard Boakye, who is going to be graduated next semester. So this is the right time, to talk about this result of his research. So next, please. So this is the outline of our today presentation. First, I will give introduction about the research motivation and followed by the objective of this research. Then briefly, I will explain the data and the methodology that we have followed to achieve the objective of this research. Then some of the interesting results that we found in this research will be presented. And finally, at the end, I will talk about the recommendation and some conclusion of our study. Next, please. So as introduction to this topic, as you know, older adults represent a significant proportion of the total U.S. population. So in 2020, they represented about 70% of the total U.S. population. And by the year 2060, it is expected that they're gonna represent 23%. So this will be almost like quarter of the total population will be consisted of seniors. So this will add more challenges to the transportation, system, and this also indicates that we need to do further research to assist them during this stage. So as you know, aging. Can you go back? Sorry. Aging is associated with reduced physical condition, and this also add another challenges for the mobility of older people. And once older people retire from the driving, they will have limited transportation options like using taxi, public transit, or Uber. And as we know, using private car is the main transportation mode preferred by older people or by all driver in the US. Next, please. Also, the COVID-19 pandemic added, another challenges for the mobility of older people. So during, as you can see in this figure, the older people have influenced, were influenced by the COVID-19 pandemic more than other age group, starting from April 22 until late 2022. So during this period, they have even more limited transportation options. And as you know, transportation plays a critical role to maintain their mobility needs and quality of life by accessing like the necessary destination like health care location. So it's very critical to continue examining the older people opinion and preferences and the needs regarding what should be provided for them to maintain their mobility. Next. Fortunately, connected and autonomous vehicle can help in minimizing the challenges of mobility of older people by providing a safe and new transportation mode for them. However, based on latest research, older people are or have more concern about using this technology compared to other age group. So and there are many reasons for explaining this concern, and we're going to talk about some of them during our today presentation. So the interesting question, one of the interesting questions that we are trying to answer in this research, could the COVID-19 pandemic can affect their willingness or attitude, or can it change their opinion about using the technology? So this also one of the questions that we are trying to address in our research. Next. So these are the three main objectives from our research. First, to identify travel preferences of senior people before and after experiencing the COVID-19 pandemic. Second, to examine travel mobility challenges of senior people before and after as well. And third is to assess their satisfaction with the transportation mobility, and also to assess their willingness to use autonomous vehicles. Next. Now we're going to talk about the data and the methodology that we have used in this study. So the main method or the data that we have used in our analysis was collected from a national survey study that was conducted among the all 50 states in USA. But for sure, before we design the survey form in this national survey, we had to do a comprehensive literature review to cover the relevant studies about this topic. So our literature review was divided into four relevant sections. Section 1 focus on examining the senior pre-COVID-19 mobility preferences and the challenges. Then in the second section, we focus on the senior post-COVID-19 mobility preferences and the challenges. Then section number 3 discuss the older adults' preferences for using autonomous vehicle. And finally, in section 4, we focus on highlighting the gaps in previous studies that we consider in our research. Next. In this slide, we are just showing example of some of the interesting results that we found from the literature review. So in a relevant study that was conducted in Germany in 2021, so 1 year after starting the pandemic, it was found that during the period of the COVID-19 lockdown, public transportation usage was reduced. And on the other hand, using private vehicle for sure has increased. In another study that was conducted in Seattle, USA in 2022, it was found that using special transportation, which is called the Paratransit, it was reduced also during the year 2022 compared to 1 year before the pandemic. In a third study that was conducted in Hong Kong in 2021, it was found that the number of travelers was dropped by almost 50% during the COVID-19 pandemic compared to 1 year before the pandemic in 2019. Next. As I mentioned, the data that was used in the analysis of this study was collected from a national survey study. And this national survey study, we started by designing a draft of the survey question considering the literature review. And after that, we have provided a pilot study among a small number of older adults to make sure that the question are clear for them. And based on the feedback that we have received from them, we have revised the survey question. And after that, we have posted the final survey question on Qualtrics survey form. And Qualtrics, as you might know, they have access to the contact information of different population in USA and elsewhere. So they helped us to collect a total of 1,507 complete responses from seniors who are living in the different 50 states in USA. Our survey was consisted of like 4 sections. Section 1 focus on talking about senior pre and post experience with COVID-19 mobility challenges. The second section of the survey focused on senior traveling and driving behavior and the challenges. In the third section, we focus on older adults' preferences to use autonomous vehicle. And then the last section in our survey form collected some socio-demographic characteristics of senior like age, gender, race, and the place of residence. We have made this link of the survey available for participants in the spring period of 2023, particularly from January to March 2023. And while we are collecting the data, we made sure that we collected the responses to be representative of the total population of the US in terms of age, sex, race, and place of residence, as we're going to see in the next slides. Next. So this slide shows some statistics about our survey responses. So as you can see, in terms of gender, 45 of the participants were males and 55 almost was females. And we have received also responses from different age group, 65 to 70, 70 to 75, and so on. And also we have received different responses based on the race. And to test whether our survey responses are well represent the total population, we did the test of proportion for different samples. And as you can see, it was the result shows that we don't have any significant difference between the survey sample and the US total population. The only exception was for one living in the race variable, which is related to Hispanic. Next. We did the same thing to test based on the state of residence to make sure that we have collected representative sample size from each state. And again, we have found that there is no significant difference between our survey sample and the U.S. population. The only exception was in the state of Indiana, out of the 50 states. Next, please. Yeah, so starting from this slide, Bernard will explain to us some of the interesting results that we found in this research, followed by talking about the conclusion and recommendation.
Thank you, Dr. Hassan. To start with, we conducted a preliminary statistics of seniors, and we found out that 30% of seniors had some form of physical limitation or medical condition or disability, which negatively impacted their ability to walk or drive. Again, we also found out that 15.2% of seniors needed the help of someone or some to be able to walk. We generally found out that vehicle ownership rate was very high among seniors, hovering around 87.5%. We also saw that only 8.3% of households did not have a vehicle. This largely agrees with the data that we got from the US Census Bureau 5-year American Community Survey, which estimated that about 91.7% of households in America had at least one vehicle in 2021. Now we went further to find out the COVID statistics among the senior respondents, which came for our test. And we found out that about 63% of seniors had not contracted the COVID-19, whilst only 29% of seniors had had it only once, as we can see in the pie chart here. And about 10% had had it 2 or more times. This also largely agrees with what we also got from CDC, that's from the Center for Disease and Control, which says that out of all the COVID cases that happened in America as of July 2023, only 13.5% of them were related to senior infections. We also saw that out of those who were affected by the COVID, 57% of them were hospitalized or quarantined for less than a week, whilst about 2.5% spent more than 3 months in hospital or quarantine, as we can see in this pie. We also found out that only 1% of seniors had to relocate to other places because of the spread of the COVID. And only 7.6% of seniors also indicated working from home. Now, we move on to our first objective. In answering our first objective, we sought to find out the travel preferences of seniors, Americans before and then during the COVID-19. As we can see from these two diagrams, there was a statistical difference, a significant one in the considered trip purposes made by seniors before and during the COVID-19. We asked seniors to indicate the frequencies with which they use these travel trips, or they made these travel trips. And we saw that before and during, there was a significant difference. We saw that the greatest difference was for leisure, which was by 42%, as we can see here. It decreased by 42%. And then followed by social trips, which also decreased by 26%. Then followed by medical, and then other trips. And then the last but of them was work-related trips, which was about 10.7%, which is also very expected since many seniors are retired and are not working. We saw that the daily and weekly trips were highest for shopping. That means that many seniors went for shopping trips more than any other trips. And for monthly and yearly trips, we saw that those ones were for medical trips as well. Now, moving on, we also sought to find out how frequent seniors made travels with some listed travel modes, which were common here in America. And as we can see in these two diagrams, we listed a number of travel modes, and we asked seniors to indicate the frequency with which they made the travels with these travel modes. Again, we saw that all the travel modes differed during the COVID, where we see a reduction except for motorcycle and then for paratransit, which is also expected because motorcycle and paratransit, when I say paratransit, that's special transit services which are offered to seniors and those with mobility challenges. These two did not change. All other travel mode frequencies change after seniors experience COVID-19. We saw that the greatest reduction was with walking, which changed by as much as 11.5%. And then we also saw that private vehicle was the highest for all combined trips. As we can see that private vehicle was the highest for all combined, whether daily, weekly, monthly, or yearly, for all combined, both before and then during the COVID, whilst transit usage remained the same before and then during the COVID-19. Again, we also asked seniors to indicate with which mode they made their trips. And once again, we saw that private vehicles were the most used for before and then during the COVID-19, as we can see here with the brown color. This was followed by walking. Walking was the most preferred for shop-related travels before and during. And then public bus was the second most popular for work-related travel. And then Uber and Lyft was the second most popular for medical trips. We went ahead again and then asked seniors what influenced their decisions when it comes to their travel choices. And as we can see from the diagram here, the three most important factors seniors considered during the COVID period were their safety and security, their infection concern, their comfort and convenience. As we can see here, the least ranked were their personal social status, cost, and then the presence of hand sanitizer in their vehicle. In moving on to answering our objective 2, which talks about seniors' mobility challenges, we sought to find out what challenges they encountered before and during the COVID-19 period. And we have here a diagram that is showing their transportation challenges before the COVID. And as we can see here, we listed a number of challenges and we asked seniors to indicate which ones they experience. And for both before and during, we see that the usage of public buses were the most challenging for seniors, both before and during, mostly because they were unreliable, they were unavailable, and they were inflexible with their routes. However, we can also say that those who were also willing to use taxis and then Uber, most of them reported that the services were expensive, and when they wanted to use the service, they were most at times unavailable, most especially during the pandemic. Again, we also sought to find out which travel mode seniors consider safest and most reliable. And as we can see from this diagram, about 90% of seniors said that driving their private vehicle was the most reliable and safest form of travel mode that they preferred. Again, we also try to find out which travel mode they consider most affordable. Again, private vehicles topped with 68.2% of seniors indicating that they were comfortable and they considered their private vehicle as the most affordable. It is also important to note that about 22% 46.6% of seniors said that they preferred walking as the most affordable travel option. Since most of our seniors were driving, we then moved ahead to find out about their driving challenges. And we saw that only 7.8% of seniors who drove indicated that they had some physical or driving limitations on the road when they were driving. And then when asked about what were their driving challenges, we saw that the three most highlighted driving challenges were their inability to drive at night, which was about 31.8%, poor visibility, which was about 12.13%, and then challenges seeing cars in blind spot, which was about 10.88%. It is clear from this that most of these challenges centered on their vision impairment. Again, we found out from seniors the impact of ceasing driving will have on their mobility. And then we saw that about 85% of seniors indicated that their mobility will be affected if they ceased driving. Only about 7.4% of seniors generally disagreed their transportation mobility will not be affected if they ceased driving. So you have here about 80.5% of seniors saying that their transportation will be impacted, mobility will be impacted if they stop driving, and then about 7.4% of seniors indicating that they will not be in any way affected if they cease driving. Then we went ahead to find out the reasons why seniors will cease driving, and we saw that over half of seniors will most likely cease driving based upon medical advice. The other reasons have been listed here. However, it's significant to note that about 3.7% of seniors indicated that they had no plans to stop driving. In answering our last objective, we found out the mobility satisfaction of seniors. We saw that only 21.5% of seniors agreed that they were satisfied with the services of the public transport in their states. However, we see that about 47% of seniors were undecided. This mainly suggests that many seniors were very highly reliant on their private vehicles and did not care so much about the public transit system in their state. And then we moved on to find out how satisfied seniors were before and during with the number of trips that they made. And we see here that about 96.4% of seniors generally were satisfied with the number of trips that they made before the COVID, as compared to 64.3% indicated in yellow with strongly satisfied and satisfied combined. 64.3% of seniors were satisfied. So we see that there's a general drop of about 20% of seniors who were not satisfied with their number of trips they made during the COVID pandemic. Lastly, we find out from with their satisfaction, how were they satisfied with their transportation mobility during the COVID? And we saw that about 88.8% of seniors generally were satisfied with their transportation mobility, whilst 49% of seniors are not, 49% of seniors were not satisfied with their transportation mobility. This likely is because of their high dependence on private vehicle as the most preferred travel mode. Then finally, we tested their willingness to use AVs as a travel option during the pandemic. And we saw from this figure that only 37.9% of seniors generally agreed to the usage of AVs, whilst 26.3% of seniors were not willing to use AVs during the pandemic. It is important to note that only 35.8% of seniors were neutral. This suggests that these seniors were undecided and may likely change their mind as and when their views on AVs change. Now to our conclusion and recommendation. We make these recommendations in the light of this study that, number one, we generally saw that seniors were most concerned about their safety, their convenience, and then their virus infection rate during the pandemic. We also saw that generally seniors considered driving their private vehicles as the most convenient and then the most affordable, even after experiencing COVID-19. And as we have pointed out, this is due to the high vehicle ownership in America, and then their choice of private vehicles has been the most affordable and then reliable. We have also again seen that the trip type and travel mode frequencies generally decreased after the COVID-19 period, indicating that the COVID-19 had an impact on travel behavior as far as seniors were concerned. We also saw from our study that most travel challenges were centered on the use of the public bus, especially with the availability, reliability, and flexibility. But with the senior driving population, we saw that most of the challenges were based on their visual impairments. Lastly, we also say that seniors were generally satisfied with their mobility, as we have seen. But they were also less likely to choose EVs even after experiencing COVID-19. We will make these recommendations. Number one, we recommend that there should be an improvement in the operation of buses or paratransit services for the aged and disabled, especially during pandemic times. More buses can be provided, and then their costs can be reduced, especially for seniors and those with disability, just to enhance their mobility during emergency times. We again also suggest that shared mobility services like taxi, Uber, Lyft could also be made widespread and should be disability friendly, so as to encourage many seniors to also use these services. We will also encourage more education and awareness programs for seniors so that they will be aware continuously about their driving limitations, and then they will know when best to stop driving so that they can also access other travel modes available. We also recommend that we improve awareness about connected and autonomous vehicles and their role in improving mobility among seniors. We can encourage test drives so that seniors can witness test drives to see how reliable and how trustworthy autonomous vehicles are to them, since many of them had issues with the trust and then the safety when it came to the use of autonomous vehicle. Thank you very much. If there's any.
Perfect. Thank you. Thank you, Dr. Hassan and Bernard. That was really interesting. We're going to leave questions till the end, as mentioned before, right? So please, anyone, if you have any questions, please feel free to write them down in the chat, and we can revisit them later on, right? Okay. Now I will introduce the speaker of the second presentation, Dr. Irfan Batur. Dr. Irfan Batur is an assistant research professor in the School of Sustainable Engineering and the Built Environment at Arizona State University. He holds a PhD in Civil, Environmental, and Sustainable Engineering from Arizona State University, along with an MS in Industrial and System Engineering from Istanbul Sahir University, and a Bachelor of Science in Industrial Engineering from TOBB Economy and Technology University. He's also a member of the Transportation Research Board's Standing Committee on Travel Behavior and Values, and serves as the Research Communications and Technology Transfer Coordinator of the Talmadge University Transportation Center. Dr. Batur's research interests encompass travel behavior, sustainable and equitable transportation, emerging transportation technologies, travel demand forecasting, and smart cities. Dr. Batur, I will turn it over to you now.
Daniel, thank you so much. So you lifted the burden for me to introduce myself. So let me share my screen.
Perfect.
So hello everyone,
good.
and welcome good afternoon from a nice, beautiful, and hot Arizona. So today I'm going to speak about transit, and we are going to mostly focus on the mode evolution during transit, during the COVID-19 period. This is important because the transit as a mode of transportation is very critical for many people, especially for vulnerable populations. And so maintaining their service of levels is important, even though there is like reduced ridership. So now that the COVID hit the hardest, the transit mode, many people have been grappling to basically contemplate and understand how the future will look like. Will the ridership bounce back to its pre-pandemic levels? Or if it will, to what extent we are going to, if it won't, to what extent we are going to see a diminished ridership? So this is the questions that we try to understand in this research. So before jumping into my presentation, I'd like to acknowledge my collaborators in this research. So it's a very large research team having academics and researchers from 4 different universities. So I'm not going to name all of them, call out all of their names, but here is their list. So I have a very typical presentation content. And then, so let's go back to the beginning of the pandemic. So, you know, when the COVID-19 is declared as a worldwide pandemic, we all been introduced to new ways of living and working, right? So we confined ourselves to in-home, limited our outside interactions, in-person interactions, and most of us started to work from home, trying to figure out how to use technology to work from home, to learn from home, to shop from home, and to socialize from home. And all this changes in our lives resulted in dramatic reductions in travel. In every aspect of the travel, we've seen dramatic reductions, and that's been highlighted as some sort of like a positive sense of reduced air pollution, reduced congestion. So we saw all these praises. However, as the pandemic eased in the late 2021 into 2022, with the widespread vaccines available to many people, we've seen a dramatic V-shaped recovery in almost every aspect of the travel. If you look at this, so this graph shows the VMT. If you focus here, we see the V-shaped recovery, right, from 2020 to 2022. It's pretty much in the pre-pandemic levels for the highway travel. And then we see the same pattern for air travel. Again, very clear, distinct V-shaped recovery. It's almost in the pre-pandemic level. So this is 2022 data. And then if you look at the transit, however, we do not see a clear pattern. It is largely it hit the pandemic hit the hardest, the transit, so it dropped about like 50%, and at the same time it is not picking up quite nicely. So we see some recovery, but it's still like very low compared to its pre-pandemic levels. And what is also very interesting to note here, that even before the pandemic, there has been a declining trend on the transit ridership in the United States, right? So it's starting with the 2013, 2014, the transit ridership has been declining. So this is largely attributed to different factors. So one of them is 2013 to 2020, where there was like a healthy economy, right? The cars were more affordable to operate, to own, and to maintain. So many people who were able to own and operate a vehicle, so they did so, and so they moved away from transit. And this is the period also witnessed the uptake, the rise of the ride-hailing services, right? So Uber and Lyft, they became very popular and started to attract a lot of transit riders. And this is the period also we started to see the increased use of technology, increased use of ICT technology to work from home, to learn from home, and to shop from home. So all this also reduced the need for travel and resulted in decreases in transit ridership. So all this this declining trend is only exacerbated by the pandemic, and that's basically sound very alarming to many people. So what is going to happen to transit? And if you look at the city by city, so this is the 5 largest transit service providers in the United States. So if you look at their recovery rates, the purple color on the right, so the range is between 60 to 76%. Really, it's still not picked up, even in the very large transit markets. This is the data as of October 2022. So with that, we formulate our research questions as follows. So how did travel mode use change over the course of the pandemic? And because we've been through a lot of changes during the pandemic in our lives, so our attitudes, perceptions, and many lifestyle preferences might have been changed. And all these changes may also relate to the transit usage. And also, what is the true pandemic effect on the future of transit? This is another, to put it another way, there has been a declining trend, right? If we eliminate the pandemic effect, okay, so what was this effect? So this decrease in trends, how will it continue? So what is the true impact of the pandemic? We'll try to isolate this effect as well. So to answer these questions, we are using a longitudinal panel survey data called COVID Future Survey that's been collected in the United States over the course of the pandemic. And we estimated a panel multinomial probit model with 3 time periods to basically track the evolution of the mode use with 4 alternative modes. So we consider private vehicle, transit, work from home, and other as 4 alternatives in this matrix. So this is the data. So it's called COVID Future Survey. It's basically designed to capture every aspect of the life, almost every aspect of the life related to COVID. So it's been designed and conducted in the United States. It's a longitudinal panel survey data. And here is the research, here is the survey team. So it included researchers from ASU and University of Illinois at Chicago. The ASU team is led by Drs. Deborah Salon and Dr. Ram Pendiala. And the UIC team is led by Drs. Sibyl Deribel and Kroos Mohammedian. So here is a quick overview of the survey. So it's an online longitudinal survey implemented in Qualtrics. The respondents were recruited through online panel, through random email addresses purchased from a vendor, and then a convenience sample. And this survey has been implemented in 3 ways. So the first way was conducted between April 2020 until October 2020. So this can be termed as the height of the pandemic. And the wave 2 started right after that and continued until May 2021. And then for wave 3, it started in October 2021 and ended in November 2021. So this is the time basically the vaccines were widely available, and we started to see that the pandemic was slightly fading away from our lives. And all this data has been made available to the public, so you can download and explore by yourself as well. So the survey used extensive research instrument. So there were over 120 questions in the survey. So we can classify these questions into 3 groups. So there were questions that are retrospective, trying to elicit information about people's behaviors and attitudes before COVID-19. And then there were questions focusing during COVID-19 period. And then there were questions that is considered prospective questions that try to elicit information. What are the expectations of the respondents for a future period? So how they're expected to behave and how their attitudes will be in that period when the COVID-19 is no longer a threat. So this is the survey section. So it collects information about demographics. It collected information about transportation and mobility patterns of individuals. And then it collected another section devoted to work and study status, whether the people had the option of working from home, learning from home, what is their work status, are they employed, lost employment, and so on. And there were also other sections dedicated to shopping and dining behaviors, to pandemic experience, to capture people's attitudes, perceptions, and lifestyles. And then about their social resources, whether they have sufficient social resources to rely on during the pandemic. And we covered a large, diverse group, including respondents from almost every state. And as expected, the darker colors represents a higher number of respondents from that state. And as expected, the more populous states are pulled higher, and that's very typical nature of survey sampling. So the way one of the sample had 10,000 respondents, but over the course of the sample, only 2,000 of the respondents, the same respondents, participated in the survey. So we call this subset as the stayer sample. So this is about 2,000 people who responded every wave of the survey. And then because in the study we focus on commute mode choice, we only limited our sample to the workers. So it's only workers, only sample, and that comprised of about 1,000 respondents. That has been who are workers and as well as who responded all the three waves of the survey. So here is the survey characteristics, the sample characteristics of the survey. Again, I'm not going into every one of the attribute distribution, but this is just to show that we captured a rich variation across a lot of individual and household attributes, and that makes our sample healthy. So that allows us to conduct the analysis that we intended to conduct, which is the estimation of a model in this research. So if you look at, for instance, the gender, it's about 58 to 41. If you look at the age category, it's capturing a lot of variation from almost every age bracket for a sample of workers. So this is quite healthy. And then we have the household characteristics. Again, similarly, it captures a lot of variation. So the bottom line of this sample characteristics is that we have enough variation across all these attributes, and that allow us to carry out a statistical analysis. And then in this survey, we have the frequency, transit use frequency of the respondents. So for the wave, in the wave one, we ask people what is their pre-pandemic behaviors and attitudes, right? And in the wave 3, we also ask the respondents what is their expected post-pandemic behaviors. Okay, so if you look at here, so those who are non-transit users or very infrequent transit users, so this is colored as gray, right? So those have either never used the transit or using it less than monthly, constitute 80% of the respondents in this group. So this share increased to 93% during the pandemic, over the course of the pandemic. And then the expected share of this group will be 84%. Okay, it will be still higher than the pre-pandemic level. And what's more interesting, if you look at the frequent users, so this green bars and blue bars, so these are the people, they use transit almost every day, right? So a few times a week and every day. So the combination of this is 12%. And over the course of the pandemic, it drops significantly. And the expected is going to be 9%. But if you look at the difference between the everyday user, so these are the 6%, now it will be 2%, right? So even in the expected future, we are not going to see the same rebound as compared to the pre-pandemic levels. So with that, we combined, okay, so we have the information about commute mode use, okay, commute mode used most often for the commute trips. We asked this question to the respondents, and then we captured their mode use patterns for the commutes. And then for those who are not commuting but working from home, so if we combine this, so this is the distribution that we have for the pre-pandemic. Okay, so this is the other, so that includes walking, biking, ride-hailing, etc. So this was about 3.9%. Okay, so it decreased to 2.7%, and it will be pick up to 4%, very similar rates. So work from home, it was 12% for this group before the pandemic. It increased to 45%, and then the expected will be 17%. Okay, again, this is the wave one, the height of the pandemic. And then for transit, it was 9%, dropped to 2.5%, and then the expected it will be 6.7%, which is again quite substantially lower than the pre-pandemic levels. Okay, so the private vehicle will largely stay in the very similar rate. So here's the modeling framework. So this constitutes our endogenous variable. So this is our model outcome, right? So we have our main outcome here. It has 4 levels. Okay, and then this main outcome is formulated as a function of a host of individual level attributes, including socio-demographic characteristics, household characteristics, COVID-related variables, and mobility and other characteristics, and as well as attitudinal latent constructs. So we not only capture a lot of socio-demographic information of the people, we also account for their attitudes, lifestyles, and perceptions. And then we also have a 3 time periods effect, okay, that's mode choice. This is the pre-pandemic, during the pandemic, and post-pandemic. Again, the during the pandemic refers to the height of the pandemic. So that's summer 2020. So here are the 2 latent constructs that we considered in the study. So one of them is social interaction propensity. Okay, so this is an underlying unobserved latent variable that is indicated by people's agreement to these 3 statements: whether they enjoy the social interaction found at workplace, whether they like seeing people and being around people, and whether they like being outside. So if you agree with the statements, this indicates that you have a higher social interaction propensity compared to others who disagrees with that. Okay, we have a very similar set of attitudes that define environmental friendliness latent construct. And if you look at the distribution of this, so these are the Likert scale questions. So the statements, we ask people whether they agree with this question. If so, what is their level of agreement? Very highly, that is indicating basically an underlying latent unobserved attitudinal construct. So this is the social interaction propensity indicators, and this is the environmental friendliness indicators distributions. Okay, and then to estimate the model, we had to structure data in a way that enable this panel multinomial probit estimation. Okay, so for that, remember we have about 900 respondents, and we have their mode choice information, okay, for the pre-pandemic, and then we have their mode choice information for during the pandemic period, and we have their responses for the post-COVID pandemic, right? So basically, we stack this 3 data sets, okay, on top of another, and we have a stacked data of 2,700 rows, right? So that represents, that is like 900 times 3, right? So in this, we have so this constitute the rows, right? So, and then we have 3 columns that indicates which of these responses belong to which periods. So if that column takes 1, so these are the dummy variables, which means this row belongs to, this response belongs to the pre-COVID period. If not, then it's 0. Okay, so we have the same thing for the COVID, and then we have the same thing for post-COVID period. And then for exogenous variables, we have the baseline effect, right? For instance, think about this. If you are high-income people, because you have available resources to purchase a car and maintain and operate it, your effect will be the same regardless of which time period you are in, right? So because you have the money, you can afford to buy a car. Okay, so this is a baseline effect. And then we have COVID-specific effects. Okay, think about you're a young person. Okay, you are not very inclined. You have an underlying propensity to, let's say, use transit. Okay, in regular level. So normally in the COVID time, when everybody is reducing their transit level, right, to stay at home, you may not do so, simply because during that time you are not as vulnerable or at risk as other groups. So this effect of the young group is called COVID-specific effect. Okay, so this is not related to the baseline age effect. So this is COVID-specific effect. So that's how we differentiate the COVID effects from baseline effects for exogenous variables. Okay, so here is a quick snapshot of the formulation for those who are interested in. So this is a mode choice model, a multinomial product model. So for each alternative, we formulate a utility function that is a function of individual specific exogenous attributes and then their coefficients, right? So their corresponding coefficients. And then we have an error term, okay? So Q to I for individual Q in time period T and for alternative I, okay? So with this error term for everybody is structured in a matrix, a TI by TI matrix. So that allows us to account for the correlation between mode choices, okay, from each period for each individual, so that these correlations are not captured in the model coefficients, so that we have more robust and reliable model estimation results. Okay, so using this formulation, we form our likelihood function, and then if you maximize this function, we get the model estimation results. So all these estimations are done in Gauss matrix programming language. Okay, in Dr. Butt's econometric powerhouse. So here are the model results. So again, we have pure baseline exogenous effects, and then we have pure period effects, and we have the interaction effects, right? So between exogenous effects and period effects. And here is the big, massive table that contain the estimation results. Okay, so let's break down this figure. First, start with this. Okay, so this line here constitute the period effects, right? So during COVID and post-COVID, okay, so during COVID and post-COVID effects have a negative impact on choosing private vehicle and transit, and have a positive effect on work from home. And that is quite expected and very intuitive. Okay, and for transit, if you look at the shade of these colors, okay, that indicates the magnitude of this impact. So the largest, okay, the largest negative impact is on transit during COVID. Okay, and then if you look at the other impacts, right? So we have an overall tendency of Black people, older adults, Hispanic people to choose car over other modes. Okay, and then if you look at here, there is a very specific environmental friendliness, okay, impact for during the COVID. So normally environmental friendly people are less likely to travel by private vehicles, but during the COVID, because of the fear of catching virus, so even those people were more inclined to choose private vehicle over other modes. And then we see that these people are also in the period and the post-pandemic were less likely to choose to work from home. Okay, we also see that immunocompromised people had a very specific period effect. So during the COVID, if you have an underlying health condition, you were very less likely to choose transit over other modes of transportation. Again, transit is very common, okay, among Black and Hispanic populations. And for those people who has longer commutes, and for those people who are highly educated people. So these people are mainly use rail mode in the high transit rich cities. Okay, and then if you look at here, for low-income people, they are less likely to work from home, which also means that they are more likely to use the other modes. Okay, for social interaction propensity, if you have a higher social interaction propensity, you are less likely to work from home, regardless of any effect. Okay, so we have this intuitive findings. And then if we summarize these findings, okay, so those pro-environments were less likely to commute by car, but more likely to do so during the pandemic. That was very interesting. And blacks were less likely to use other commute modes compared to transit, work from home, and private vehicle. And those with higher social interaction propensity and have a pro-environmental lifestyle are less likely to work from home in the post-pandemic period and in overall in all the periods. And then here is the specific COVID period effects, right? The work from home increased significantly, and then transit decreased substantially. So this is the impact of the COVID. And then if you look at the younger adults, they are less likely to use private vehicles during the pandemic. Okay. This is simply because they can just continue to do what they are doing. They feel that they are under very minor risk when catching the virus. So they don't really impact their lifestyles. However, so all these results so far show us the direction of the effects, but it doesn't really give us the true magnitude of these impacts, right? So I have the coefficient. So what does that mean? Okay, they just tell me the correlation. So is there a way that I can compute the future shares for every segment of the society? Can I get like the commute mode choice distributions in the future, right? Can I predict this distribution? Yes, we can. We can compute the average treatment effects, and then we can determine the directionality and magnitude of this model estimation results, and using the joint probabilities, we can then compute this frequencies for every segment of the society. Okay, so here is we selected some of them that might be targeted by transit agencies as potential markets where we will see the most recovery in terms of transit. Okay, so for people with most social interaction propensity, okay, so they were in the pre-pandemic, their mode choice were 9%. And that will increase to 7%. That is dropped to 3% during the pandemic, and it's expected to reach the 7%. For pro-environment people, it was even higher before the pandemic, as expected. These people use transit more. So 11% were using transit. Okay, that dropped to 3%, and then this is expected to increase 8%. For low-income people, it was about 9% before the pandemic, dropped to 4%, and increased to 7%. For older adults, it was 6%, dropped to 2%, and then increased and is expected to increase to 4% in the post-pandemic. And for Hispanics, it was the largest, 13% among Hispanic population before the pandemic. That has dropped to 4% during the pandemic, and it's expected to increase 10% for this group. Okay, so the takeaway is minority groups and those residing in households with no cars are more dependent on transit. And transit will recover, but not to the pre-pandemic levels in the foreseeable future. And for most market segments, the transit share we predict that will be about 70 to 80% compared to pre-COVID periods. So I also, while I was putting together this presentation for this seminar, I also wanted to check out what is the current situation in terms of transit recovery in US cities. So this is March 2023 data. So it suggests that for the largest transit markets, for the larger transit markets, we see that the recovery is between 60 to 80%. So our predictions were about 70 to 80%. However, the recovery is still in the process. So I think our estimations are very reasonable and proving their reliability as we get more data. And looking more specifically for different markets, okay, let's say compare Louisiana versus California. For Louisiana, it's pretty much in the pre-pandemic level, except for this transit agency, it is about 32%. But for the others, it's like 93%, 124%, and 85%. So it's getting very close to the pre-pandemic level. And however, for the California market, if you look at the San Francisco, it is still very, very substantially low, right? So 43% and 65%. Okay, so this is in March 2023. So this suggests that there is also this recovery will be very context dependent. So we should not expect the same recovery in California versus in Louisiana versus in Arizona versus in New York. So this is going to be very context dependent. So with that, here are the conclusions. So the pandemic impacted commute travel and it took the hardest hit on transit. And work from home will stick in our lives. Okay, it will be a major phenomenon that will dominate the worker's life. So, and its impacts will be will continue on private vehicle and transit. And for transit equity and as well as to sustain transit ridership levels, I think the transit investments and enhancements should focus on minority groups. So how can we advance their transportation needs? Okay, how can we advance the transit systems that can address their mobility and transportation needs? Okay, so in the study, we provide the predictions into the future, and these predictions have been instrumental in informing the future post-pandemic transit planning. So that's why it's important. So with that, I conclude my presentation. And I'm open for any questions, and thank you so much.
Okay. Second. Okay, thank you very much, Dr. Batur. That was excellent. Now, this concludes the presentation portion of our webinar. Now we will start receiving questions from the attendees. I saw that we already have one. I have a few too. Okay, so if anyone has any questions, please let me know. Otherwise, I'll start with the one in the chat. Okay, I think let's start with the one in the chat. Okay. It says, okay, thank you for the captivating presentation. Could you please share some your thoughts on why seniors who seek flexible and dependable transportation options appear to be less inclined to embrace AVs?
Yeah, I can take this question. Yeah,
let's
I
do
think
it
this
one
is
at a time. Yeah. Okay.
Yeah, I think this is very good question. And actually, in our study, we have asked older participants to report some of the reasons that could, minimize their willingness to use autonomous vehicle in the future. And some of the, reasons that we have got, reason number one, they mentioned that they believe that this technology need more testing before it can be implemented. So they believe that more testing should be conducted first before they can use autonomous vehicle. The second reason that some of them reported was related to the latest, traffic accident related to autonomous vehicles that happened lately. So this kind of accident also they reduce their willingness to use the new technology. And in addition to that, based on my experience, as you all know, older people are not among the first, age or groups that can implement a new technology. If you look back 10 years ago or 15 years ago, when social media started to be common between a different age group like Facebook or Twitter, At the beginning, older people didn't, implement this new technology a lot. But you can imagine now, if you see most of our parents and grandfather and mother, all of them have social media accounts like Twitter or Facebook right now, and they are using it more frequently. So I believe it's a matter of time. They need to see other age group using this technology. Once they see that the technology is working fine without any problem, their willingness to use this new technology will be increased.
Okay, perfect. Thank you, Dr. Hassan. Dr. Batur, do you have anything to add to that? I don't know if you had some questions on that part, right, from the survey.
So autonomous vehicles is also we have some research on autonomous vehicles in addition to what Hany said. I think there are also things that we should consider, that these older people, they are very settled in life, right? So they have their daily routines, their daily routines and habits is very hard to change. Okay, they're already settled in life, they're happy with the life, so they're not looking for much change in their life. And there are also some a lot of speculations about the safety issues related to AVs. Okay, so this is also one of their major concerns. And so that's why these people, among all the age groups, what we observed in the literature and in our studies as well, that this group is the least likely group who will adopt or ride in any autonomous vehicle. So, however, the AV companies are basically positioned themselves in a way that they promise to serve the needs of these people, this aging group, and they have the most driving limitation laws. They have the most driving limitations. So if they are going to serve these people, then I think we have to we really need educational campaigns and awareness campaigns, and even some tryouts to get these people to try these vehicles, and to give them a sense of experience and a sense of basically confidence in this technology.
Yeah, perfect. Thank you. I also have two questions. The first one is for both of you. So we can start with Dr. Hassan, because he presented first. So it's thinking about the future. Has anyone proposed a solution to the shortage in the use of public transportation in a situation such as COVID-19? And also, are these solutions already under motion, right? Just thinking about a future situation or similar situation to what we had, right? Maybe a way to fight this decrease in public transit use, right?
If I got the question correctly, the question is asking about a solution to increase public transit use in the future if we face a similar pandemic like COVID-19.
To avoid the decrease, to avoid a decrease like the one we had, right?
Yeah, this is a very good question as well. As we found in our research, we asked them about what are the main factors that will affect your choice, to select the mode of transportation. And we found in our study that safety and security for them is the first factor that will affect their choice to use public transit or to use any kind of transportation mode. So I would say that public transit agencies, they should work harder to improve the safety and security of of all road users, and especially older people. During any kind of pandemic like this, they need to improve, how the buses is provided for a different road user to increase the social distancing. If we have something similar to COVID-19, to reduce the likelihood to spread the virus between passengers. In addition to, if we are talking about older people and person with disabilities, for sure, one way to improve the usage of public transit will be to make sure that our public buses are more equipped with the devices that will improve, will help older people and person with disability to use the public, with minimum help from others.
Okay. Thank you, Dr. Hassan. And Dr. Batur, do you have something to add?
So my research basically do not speak to this question, and this is a
Okay.
very indeed
It's okay.
difficult question. No, but I have some thoughts, not related to some facts, but my thoughts is so what I think is like fundamentally the pandemic and transit basically cannot go well together, right? So just like we cannot have many people in the stadiums or in any concerts, we cannot confine so many people in a transit vehicle. So during the pandemic. And then in order to serve the people, to keep the ridership, so the transit services have to increase their ridership, okay? And then with limited number of people, limited capacity within the vehicle. And this is going to be very expensive. So what could be another solution is that, especially to serve the vulnerable populations, so the transit agencies can understand their mobility needs, their critical needs. For instance, if they need to do grocery shopping using transit because they cannot use a car. So some of their buses of these transit services can be repurposed, okay? And then to serve to those people, basically doing deliveries for them for their grocery shopping. Instead of getting them to some grocery shopping, this buses can be repurposed to take the groceries from the grocery shop and deliver it to those people. I think this could be a useful way to repurpose the transit and still serve the needs of the society during a pandemic.
Yeah, that's perfect. So, and at the same time, with an older population, you save them the hard time of going to get the groceries. Yeah, it solves the issue, right? At least part of the issue.
Yep.
Okay. I also have another question for Dr. Batur. Can the slow recovery of public transit mean that the current efforts behind public transit have decreased compared to the pre-pandemic levels?
Can you repeat the question, please?
Sure. Can the slow recovery in public transit mean that the current efforts behind public transit have decreased compared to pre-pandemic levels?
I see. I honestly don't think so. I think it's mostly about the shift in the travel demand. Okay, so if you look at if you remember the graphs that I showed,
yep.
The graph by cities is also showing the service levels. If you look at, for instance, New York or Boston, the service level even higher than the pre-pandemic level currently. Okay, so you basically have much more efforts, but you are still not bringing people back. It's because the commuting by transit is not fun to many people, right? So it's time consuming, first of all, and it's very fixed route. It's not very flexible. And there are a lot of other issues, security issues involved, the health issues are involved. So all these issues need to be addressed I think, with more nuanced and comprehensive efforts. So with the current efforts, I think it's pretty much the similar pre-pandemic to post-COVID, but in order to basically advance the transit systems, I think more are needed.
Okay. Perfect. Thank you. And yeah, this question I had it before, I guess before looking at those graphs. It's true. You were putting them side by side, right?
Yep.
Yeah. And well, let's see if someone has any other questions. I don't see any more in the chat. Well, at the moment, I think there are any other questions. Well, if anyone has any other questions, please let me know, and I'll let the presenters know. There will be a recording of this webinar in our YouTube channel that we will make available to all attendees and also to the presenters. And okay, so again, I would like to thank our presenters for their time and technical presentations. And I also want to thank the attendees. Please let me know if you have any questions, as mentioned before, about the series and about Tran-SET. And otherwise, have a great rest of your day.
Thank you so much, Daniel.
Thank you. Thank you
So
for
much for organizing.
thank you for joining today.